Male pattern balding is common. I think it's fine if you don't want to treat your hair loss. I think you can accept that hair loss and not worry about it. There's also a cohort of people that are worried and they want to do something that will slow down that progression of thinning, and they just don't feel confident about themselves. In terms of trying to establish if you've got male pattern balding, there's a couple of ways you can do it. You're looking to see if the hair loss is gradual, so not that it sheds overnight, but actually that it happens over months and several years. Now, sudden hair loss often tends to be another cause. That doesn't tend to be male pattern balding. That tends to happen usually over days or weeks, and that generally has more of an autoimmune or other causes that can be chronic illness, sudden illness, etc. There's two main areas that you get the hair loss. So the temples, the frontal area as people will call it, and then what you'll notice is that hairline will start to regress backward. What you'll tend to find is that middle area will be quite resistant, and you'll get something that commonly people call a widow's peak. So that central area will retain, and you'll get kind of an M-shaped hair loss. The second area that you'll get to hair loss is the crown. So that's the top area. So normally where, if you were a royal, you'd be putting a crown on your head. And that will gently thin, it will become thinner, and over time that area will become larger and larger. As they start to get bigger and bigger in terms of the hair loss, they just start to merge together, and you get overall thinning and balding in the top area of the hair. Moving on to the main cause of male pattern balding, like broadly it tends to be genetics. That's about 90% of cases. And that's called androgenetic alopecia. A bit of a mouthful. Now, the result of this is generally your hormones that attack the hair follicles. So the hair follicles are almost like the bulb from which your hair grows. And they're sensitive to a hormone called DHT. So testosterone converts to dihydrotestosterone. Dihydrotestosterone attacks those sensitive hair follicles. So often in the temples and the top and the crown, but not the back and the side. So over time, that DHT thins those hair follicles. And when they die, that means you have no further hair in that area. So that's why you get complete balding in those areas that have been attacked. Male pattern balding is treatable. So often what I find with men is that they wait until all the follicles are dead and then they try to go onto treatment, and that doesn't work. So ultimately you need to start to notice the early signs of male pattern balding. So when that recession first starts, and when that crown thinning happens. But if you can get onto treatment early, you can start to attack that DHT. So you want to reduce it down. And there's broadly two treatments that work. So finasteride and minoxidil-based ingredients. Now, I think people do know about these treatments, but they don't know the details of exactly how they work and the different forms in which you can utilize them. So finasteride is effective in about 90% of men, and it reduces the DHT down by about 70%. And it does that by reducing the enzyme that converts testosterone to DHT. So because that conversion doesn't happen, you have a reduction in that DHT. And it's generally available in two forms: a tablet or a topical solution. And generally you want to be managed by a clinician who can give you advice on how to use that, but it's generally the most effective form of treatment for hair loss. So if you're going to pick one agent to be on, that's the one I recommend. The second agent you can be on is minoxidil. So minoxidil's got quite an interesting history. It actually was a blood pressure tablet. And when they gave it to men as a blood pressure tablet, they realized they started getting hairy in all the unusual places. And so the pharmaceutical industry then repurposed that into a solution. What it does is it draws blood supplying nutrients to the base of the hair follicle. That tends to thicken the hair and also prolong the hair growth cycle. And so almost think of it like a hair fertilizer. Minoxidil is also available as an oral form, and it's really effective. And the reason is because it bypasses having to work with the enzyme that exists in the follicles and actually just enters the bloodstream directly. And so it's often my recommendation for the most effective form of minoxidil. Another question people ask me is, Doc, if hair treatments work, why is Jeff Bezos bald? You know, maybe he didn't want to treat his hair loss, or actually maybe he left it too late. If you leave your hair follicles too late, they will just die. There's no way of resurrecting them, at least with medication. Now, another question I get is, why don't I just have a hair transplant? I can just have a once-off treatment, I can go and have my surgery, and then I've got a full set of hair. Unfortunately, life's not that simple. You can get a hair transplant, but you generally only get it in the areas that it's actually got complete hair loss. You can sometimes only have a limited number of follicles that you can use. And so you often don't tend to do a procedure in all one go that you cover all the areas that you're thinning. And so really, even if you go and see a hair transplant surgeon, they'll say to you, try to retain the hair that you've got and plug only the areas where you've got complete hair loss. And often they'll say to you that you should come back for a second transplant or a third transplant to treat subsequent areas that might start to recede. They will also strongly advise you to be on treatment. So that means being on the medical treatments that you require in order to retain the hair that's thinning but not completely lost. Now, I want you to get the best results you possibly can on hair treatment. We really have to get you onto them to really understand what outcome you're going to get, but it will be one of three. That you'll get a reduction of the rate at which your hair starts to shed. So rather than losing all your hair, let's say by 30, 35, you might do it by 55, and that will give you more years of having hair on your head. Number two, that you get complete stopping of the hair loss, so you don't lose any more. So imagine you start the treatment at 25, you've got the same set of hair at age 35 and maybe by 40. The third outcome, which everyone tells me they want, and I can understand, we all want more than what we can get, is regrowth. So where they've lost hair, they want it to be as thick as it was when they were 18. The most commonly asked for outcome is wanting hair regrowth, and I understand that everyone wants full results. They want the hair that they had when they were 18. Often what happens with hair, it moves from terminal hair to vellus hair when it's shedding. So thick hair to very thin. And you can start to remove that thinning and move back to those terminal thicker strands. But to do that, you've got to do a couple of things. So you've got to take the treatment as early as possible. Number two, you need to be on the treatment for at least 12 months. So that's when you see the most results. I have so many patients that come to me after 3 months and say, doctor, the treatment's not working. You have to put the time in, you have to put the effort in, you have to take the treatments, take pictures at baseline. We're really poor judges of how our own hair loss is going. And so much like you don't notice your hair loss at the very beginning stages, you actually don't notice your hair regrowth. So take baseline pictures, take pictures every 3 months, and carry on till 12 months. Lastly, I'd say, ensure that you are supported by a clinician, someone who is an expert at hair loss and can ensure that you get the right treatment and they're with you along the journey